So how do you prepare for an interview and predict what kind of questions that they can ask you? So a lot of the time, medical schools have something called interview criteria, which can be offered on their website. They may email you specifically what they'll test you on when you get your interview offer. And sometimes the information is available in freedom of information, which can be found on websites such as whatdotheyknow.com. You can email them or contact the admission team directly. The reason you want to know this is you want to make your preparation as effective as possible. Focus directly on what they're likely to test you on. You do not want to find the needle in the haystack. Write down what questions you can be asked based on each criteria and practice and seek constructive feedback with your friends and family. Aim to improve your weaknesses. First, jot down a few points on what you're going to say to help structure your answer. You want to answer questions naturally, and you definitely don't want to sound scripted. Here is an example from Newcastle University. This example shows what kinds of areas they can assess you on. So for example, one of the interview criteria is motivation and commitment that's required to becoming a doctor. They can ask you on why medicine, your work experience, or your insights into healthcare, or your understanding of the role of a doctor, etc. This is another example from Leeds University, which shares similarities with Newcastle. For example, motivation for medicine, communication skills, etc. Since interviews can be multiple mini-interview, MMI style, criteria such as communication may be tested with role-playing or explanation of a task rather than, for example, what does effective communication involve? Show me an example when a doctor demonstrated good communication skills, or give me an example where you've shown good communication and what did you learn? Or it could be a bit of both. For example, doing a task and then answering a few questions based around communication afterwards. Usually in MMI or panel, each criteria is marked out of 5, and what you aim for is between 4 and 5 in each section. Don't worry if you perform badly in one session, you can always pick it up in the next one with a fresh interviewer.